Here's a CT scan of the abdomen and pelvis that was performed in multiple phases. And so this initial phase that we're looking at here is the arterial phase. You can tell that because most of the contrast is within the aorta. And we can see within the liver itself, there's a large mass that is having quite extensive mass effect on the IVC. We can see the IVC right here. If we follow it down, we can see that this is being pushed. And so this looks like it's probably arising from around the area of the caudate lobe of the liver. This mass demonstrates arterial enhancement. You can see the arterial arteries, the arteries branching into the lesion itself, causing some enhancement there. And when we look at the more delayed phases, and I'm going to pull up a delayed phase here, we can see that this area demonstrates enhancement within the lesion itself with areas of necrosis. Now on MRI, we can see on the T2 weighted images that it's got areas of low T2 signal, so it's hypointense, and areas of high T2 signal as well. On the T1 weighted image, here we can see that it is hypointense compared to the background liver. On the arterial phase, we can see that there's areas of enhancement, so this is arterially enhancing. And as we progress through to the portal venous phase, we can see that there's increased enhancement on the portal venous phase, and on the more delayed phase, we can see there's even more enhancement there. And so this has characteristics of something of a tumor in which you have areas of necrosis, but you have also arterial enhancement that has persistent enhancement on delayed phases, and in fact becomes more intense on has more uptake of contrast on the more delayed phases. And so that's characteristic of usually some kind of fibrous or dense tumor, something that is able to take contrast in but then has a hard time getting rid of it. And so things that you think about are, scar can do that, but cholangiocarcinoma would be in the differential for this lesion, but also solitary fibrous tumors. Solitary fibrous tumors usually arise from the pleural surfaces, but they can arise from the liver, and they can demonstrate arterial enhancement with progressive enhancement on the portal venous phase and the more delayed phases. And so these ultimately need to get a biopsy to differentiate between a cholangiocarcinoma and a solitary fibrous tumor. This patient ended up getting a biopsy, and this ended up being a solitary fibrous tumor of the liver.